Thank you so much for asking me to say a few words as part of your quality improvement conference today. I'm Amar. I'm a clinician. I'm a forensic psychiatrist. I work in East London, where I'm the Chief Quality Officer at East London Foundation Trust, and now National Clinical Director for Improvement at NHS England. So, trying to support the whole health and care system in England to adopt quality improvement as a way to identify and solve problems. Really delighted that you're taking time out of your day jobs to come together and think and learn about how to improve the care and outcomes for the people you serve. I've had the privilege of supporting my trust, East London Foundation Trust, over the last 12 years now to learn how to do that better. Trying to move away from the approaches of assurance and grip and control and performance management to thinking about ways that we can involve people more meaningfully in improving the care that they receive and that they're delivering. When we talk about quality improvement, we're describing a systematic approach to solving complex problems. And it's fundamentally different to how we've tried to improve quality of care for the last 70 or so years in the NHS. Up till now, we've mostly been relying on getting a group of experts in a room, debating, deliberating, look at the evidence base, and coming up with standards or guidance that they then codify and issue to clinicians to adopt in their practice. And of course, I think we've all seen that that has limited benefit. Improvement in healthcare is more complex than that. The world in which we're working is more complex than simply telling people what they need to do. And in East London Foundation Trust, we've been on a journey with this for the last decade now. You may or may not have heard of East London Foundation Trust, but we're a relatively small health and care system. We provide mental health, community care, community health services, and primary care to a population of about 1.7 million people in East London and in Bedfordshire and Luton. And about 60% of our work is mental health, and now 30 to 40% is community health too. And over the last decade, we've been learning how to support our teams to be able to have the power to make change happen and to apply a systematic method to doing it. It's taken a long time and it's taken a lot of work and persistence to really be able to adopt this way of working. And it needs a number of different components to it. It's not as simple as just working with the willing and running a few projects. If we're really intent on improvement as being the way that we run the organisation, the way that we improve care, it needs a number of different things to happen. First of all, it needs us to support our teams to come together around things that they really care about. We need to help our teams learn what it takes to improve complex systems. Sadly, most of us come out of our professional training without the kinds of skills that we need to improve the systems in which we work. I've gone through medical training, psychiatry, postgrad training, and a number of other postgraduate qualifications, none of which gave me any information or skills about how to improve the system in which I ended up working in. So we've got to build those skills in our workforce, and I know you've been doing that in your organisation for many years now, and that this is probably a never-ending effort given the number of people that are coming in all the time and the movement in healthcare. After 10 years at Elft, we are still continuing to build skills in our workforce at many different levels. And people need different levels of skill, from just the introductory level that people need as they come into the organisation to be able to get involved and understand the language, to the skills that you need to really solve complex problems through a project that may take 6 or 9 months, solving a really complex issue that's going to need a team of people working together concertedly for several months, to then starting to build the infrastructure that supports teams. We have 350 teams, and we can't just rely on the command and control hierarchy that the NHS is so good at to be able to help us innovate and experiment. We've had to build almost a second infrastructure that gives teams really close support, not just through improvement coaches who are really skilled at improvement, but also from leadership. And it's the leadership shift that's really critical in this work too. And for leaders to be able to see that their role no longer is about problem solving, but it's really about problem framing. It's about creating the environment in which their teams feel they have the power to make change happen, to try things out, even if they don't work. but to do that using a method so that it's controlled, it's structured, it's thought through and planned. And that's what quality improvement gives you. It's a really structured, systematic method to work through problems that can seem really complex and almost impossible to solve. I know in my own organisation, we began this journey 12 years ago with just a small number of teams who started experimenting with it and adopting the method to solve things that they really cared about. One of those teams was a ward, an inpatient ward that came to the executive team at the time and said they really wanted to tackle the issue of physical violence on their ward because it was the most important safety issue that they were facing. The staff felt unsafe when they were coming into work. There were a number of injuries. People were off sick. The service users felt unsafe. They weren't able to recover well. And so they wanted to tackle this topic. And I think the executive team at the time was pretty anxious about that, a little bit nervous, thinking that is a really difficult problem to solve. I think, 12 years ago, most people came into work in mental health services just assuming this was part of the job, that they would get assaulted from time to time. It was the nature of the challenges of dealing with people who are vulnerable and really unwell. But the team started to apply quality improvement. They brought together a range of expertise, staff, patients, families, police, carers, a whole range of people. And they started to think about what led to violence occurring on their ward. They looked at the evidence base to see what might have been tried before. There wasn't much, but they brought a few ideas into their theory. And they came up with their own ideas about what they could try differently. They then used the method to test and learn. And they tried a number of things out, but they seemed to realize that 4 things seemed to help them better predict and then prevent violence from occurring on their ward. And this ward actually managed to reduce violence by 65% over the year that they were doing this early piece of quality improvement work. And then, we learned from that ward how to take ideas that seem to have worked in one setting to many settings, what we call scale up and spread. And obviously we have 52 wards, so we weren't content with just one ward having solved this. We wanted to learn what would it take for every ward to be able to achieve the same kinds of results. And of course, the first time we tried that, it didn't work. We took a few months, and the neighbouring wards in Tower Hamlets thought that they would try these ideas out, and they were very excited, and they thought it would make a difference, and it made absolutely no difference. And we had to stop and pause and really think again about what it was going to take to scale this. And so just going from 1 ward to 6 wards took us another year. And we learnt that we needed to put a proper structure around it with an executive sponsor. We needed to bring the teams together to learn from each other. We needed a really good measurement system so everybody could collect the same data and could see it in real time. We needed every team to build their own theory so that they understood their own context. And they really owned this effort. Obviously learning from what the other ward had done so far, but building in their own ideas and theory as well. And then doing that systematically over the next 4 years, we managed to reduce violence across the whole organisation by 35%, which has been sustained now. And actually, the learning from that program has now gone into the NICE guidance. So if you look at the NICE guidance for managing and preventing violence in mental health settings, it includes the work that our teams have been doing for many years now through quality improvement. And so actually quality improvement can actually help us discover better ways that then become the new evidence. And we now use quality improvement in East London for all of the complex issues that we face, from the waiting times for our community-based teams to the experience of our staff. We've had 84 teams go through quality improvement projects focused specifically on how to really connect back to the meaning and purpose in their work, building joy into their daily experience, and thinking about what they can do together as a team to get rid of the things that just get in the way and the things that stop them doing what they really care about. And to really adopt this way of working takes a lot of time and effort and consistency and persistence over many, many years, but it's well worth it. We've certainly seen the benefit in our organisation in terms of improving care and outcomes. There's the range of ideas. When you unlock the creativity of thousands of staff, you see some amazing things happen, but you have to put around it this, to give people the skills and put around them the support and structure to enable them to really adopt this, because it's hard. We're all busy in our clinical worlds, and actually we need the constancy, the leadership attention, the nudges, and the external support that just gives us that momentum. And I think really critical to that is involving our patients in quality improvement work too. We know how important it is to have diverse perspectives. But actually, when we look back at our first 500 QI projects, we realised that the ones that had truly involved patients as partners in the quality improvement work had seen a 2.8 times greater likelihood of actually achieving results. And that odds ratio was pretty impressive to us. And so we have now made the involvement of patients and carers absolutely fundamental to the way that we do quality improvement in our organisation. And over the last year, you may have seen that NHS England has also released a framework called NHS Impact, which outlines the key sort of components we need to all think about if we're going to adopt and embed improvement into our way of working. It's not going to be a huge surprise to us, but there's 5 components of NHS Impact. They're pretty non-controversial, but it begins with creating shared purpose and vision. And I think that's a really important place to start, because organisations need to have a really clear, compelling purpose. And our improvement work needs to be aligned to that, so that we're not working on pet projects that just 1 or 2 people care about, but we come together as teams thinking about what really matters most to us, and that we align that to the mission of the organisation. And I know you've been doing that really successfully in your organisation, and I've had the privilege of observing and supporting your work over many years now with Sarah's guidance and leadership from the executive team. You also need to think about how you're going to build capacity and capability at all levels of the organisation, as I've already said, from the board, from the executive team, through to your improvement team, and all the way through to your clinical teams, your corporate support teams, and your patients and communities. Everybody needs to know how we're going to improve together, and have a really simple common language that binds us all together and helps us learn from each other. When you think about how we create the right culture in the organisation, and that really comes from leadership. And I don't just mean leadership from the senior leaders, but from all leaders. All of us are leaders, and our behaviour every day creates the culture in the organisation. So all of us need to think about the way we talk, the way we interact with each other, the way that we ask questions, the way that we react when things don't go perfectly well. And we need to create a curious mindset, an approach that encourages people closest to the issues to really understand them deeply, to bring their own experience and wisdom, and then think about what they can do differently, and allow them to apply the method to solve those problems in a really consistent, systematic way. So I guess I would say my message to you today is, thank you for all the work you're already doing, because I've heard from Sarah and the team just what impact it's already having for your local communities. I hope you're finding the joy that there is an improvement. It's hard work. There's no getting away from the fact that solving these kinds of complex issues takes a lot of effort and time. But I hope you're finding it to be joyful. Staying close to why we really come into the field of medicine and healthcare, and trying to make things better for the people we serve, and our colleagues, the people we work alongside. There's probably no more pursuit that's more joyful than that in my work. It takes courage, though, and so the stories you're telling today are really important. You need to be able to capture those and tell those stories to be able to build confidence, build belief that this is the way we want to work in the future. And you need to do it with rigor. Apply the scientific method, and be able to demonstrate the impact that the work is having, so that we can continue to strengthen our resolve and our approach. The year or 2 ahead is going to be tough. There's no getting away from it. But if we're really going to improve quality of care, if we're really going to improve the health of our local population, and we're going to do that in a way that makes use of public resources in the best possible way possible, and make sure we're as productive as we can be, I don't know that there's another way to do it other than by involving our teams in really thinking about what matters most, what's adding value, what's not adding value, and then making changes, continually making changes and adapting and learning to be able to really deliver the results and outcomes for the people we are here to serve. So have a wonderful day today. I look forward to hearing about your progress over the coming months and years, and know that the rest of the country is behind you in the work that you're doing ahead. There are many similar organisations on a similar journey, so I hope you're learning from them as you're deepening your own insights and wisdom about how to keep improving your own organisation in order to meet the needs of your local communities. So thanks very much for inviting me in. Hope you have a wonderful day, and I'll see you soon.